Stem cells are the repair system of the body. It can be found in any tissue in the body.
What are the different sources of stem cells, sir?
We can extract cells from the adipose tissue, that is fat. We can extract cells from the bone marrow or umbilical cord. These are the sources. That patient came on wheelchair for the very first time. And after my treatment, when she came with the stick, she was walking.
Now there's a lot of misconception about stem cell therapy. People often think this is unsafe or experimental.
It is very safe. As I said, I've been doing this for last 10, 12 years and we have treated thousands of patients.
Stem cells help you with arthritis and joint pain, sir?
We do treatment with the condition of osteoarthritis, rheumatoid arthritis. We have a hyperbaric chamber here, which is first in Gujarat, in fact. Without any side effects, we can treat cancer patients. We can give them a quality of life. As I said, they are the master cells of the body. They can go and repair that part, any part of the body.
Hello everyone. Welcome to CellStar's podcast today. I am your host Vishakha and we have a very special guest today, Dr. Divyang Patel, who is an orthopedic surgeon and also a leading expert in regenerative medicine in Ahmedabad. So stem cells is basically an advancement in modern science today, and not everybody is very familiar with it today in the fast life. So we'll all break it down for you all today. Hello, sir.
Thank you, Vishakha. I'm so excited to be here.
Okay, let's start the basics. Dr. Patel, as we all know, people are not very familiar with stem cells. So would you little brief us about?
Stem cells are the repair system of the body. It can be found in any tissue in the body. We can say master cells of the body or building block of the body. They have ability to repair or regenerate the damaged part of the body, or they have potential to convert into the same cells. Let's say if I inject into the muscle cells, they become muscle cells. If I inject into the liver cells, they become liver cells. If I inject into the kidney cells, so that way it works.
That's wonderful actually to know, right? Actually, it's very fascinating as well. And what are the different sources of stem cells, sir?
There are different kind of sources in the body. We can say we can extract cells from the adipose tissue, that is fat. We can extract cells from the bone marrow or umbilical cord. These are the sources. But here we use mesenchymal stem cells derived from adipose tissue, that is fat.
All right. I'm sure, so this must have helped so many people around in,
Of course.
as patients. So do you have a success story of anybody from last decade that you've been practicing this?
There are so many patients we have treated with the stem cells. In fact, I have treated maximum number of patients in orthopedic conditions. And there are a number of patients we have treated and they are very good with this treatment. They are doing very good. So, I remember one patient, he came here and I said, no, I cannot treat you because your condition is not that. But even after that, they said, but we want to go for this treatment. We wish to go for this treatment. And finally I did. That patient came on wheelchair for the very first time. And after my treatment, when she came with the stick, she was walking.
Okay,
So that is the power of stem cells basically.
That's really amazing to know that it is the modern science is beating the conditions we thought once were untreatable.
True,
Yeah.
true, very true.
Nice. Now there's a lot of misconception about stem cell therapy. People often think this is unsafe or experimental. So would you like to clarify on this, sir?
Sure. It is very safe, Vishakha. As I said, I've been doing this for last 10, 12 years and we have treated thousands of patients. It is nothing like that. There's no risk, no side effect, and we follow the guidelines, rules and regulations. Every country has their own rules and regulations, but we follow that.
Yeah.
And it is 100% approved treatment.
It is under the regulatory status and it is an ongoing research. We all know it's modern science.
Of course. We are in modern science.
Yeah, absolutely. Okay, let's dive into some specific applications of stem cells. First, can you tell me that stem cells help you with arthritis and joint pain, sir?
Of course.
These days?
Of course. We do treatment with the condition of osteoarthritis, rheumatoid arthritis. Arthritis basically it's an inflammation of joint.
Yeah.
And stem cell has that ability, anti-inflammatory effect. So stem cells reduce the inflammation of the joint. It repairs that part. So that's how it works.
Okay, amazing to know, right? It is like you actually go through so much without pain.
Yeah,
There's so much more advancement in today's world.
you are
Okay,
right.
can you share a patient's case, like you already shared with a patient's case, like with that lady with the joint pain? So I think it's amazing to know this success stories around the world, sir.
It is.
Let's move towards the stem cell therapy is also gaining traction, sir, these days. It is like a new adaptive way into the world of anti-aging and hair growth.
Yeah.
Yeah?
Nowadays it is, yes, it is going on. And for anti-aging and hair growth or any cosmetic conditions, not only stem cells, we treat patients with the exosomes. We have everything like regenerative medicine, all kind of medicines we have, like stem cells, exosomes, peptides. We have organ-specific peptides also.
Oh.
We treat patient with the collagen for the cosmetic purpose. So these are the things we do here. We have hyperbaric chamber here,
Oh.
which is first in Gujarat, in fact.
Oh, nice.
So we have all kind of facilities here in this center, this facility.
Wow, so that skin rejuvenation part and hair growth is amazing, but to know about hyperbaric is even
Yes. In fact,
surprising.
if you go only for hyperbaric chamber, that will also give you some kind of yes, benefits.
So what hyperbaric chamber? How can it help a person? With a suppose let's talk about smoking habits of people with COPD, severe asthma. People have such conditions that they want to know.
You are right.
So how does it help?
So in that case, what hyperbaric chamber does, actually we give oxygen with the pressure. So normal atmospheric pressure, we can increase that into twice of that normal atmospheric pressure or 3 times more than that.
Okay.
So it gives patients that more oxygen to their blood, and it helps in the repairs or it helps into healing the particular or infection or any kind of diseases. Yeah,
that's really nice. It's a lifestyle change, I would say.
Yeah.
And in today's world, such a fast and dynamic place to live in, we need such therapies in our regular life to have a better metabolism and everything.
True,
I am sure people would be more interested and would love to come to CellStar for these treatments.
Of course, yeah.
Let's talk about what kind of category people can be treated, or maybe come under this treatment.
Vishakha, there is no such kind of category. We can treat any patient here in this facility, but there are some criteria we have to fulfill, and of course we can treat any patient.
Oh, so yeah, it is up to their willingness and
Actually.
And let's now talk about the chronic diseases, the generic diabetes, hypertension, liver, the neurological conditions also, because nowadays I think people are, in every household we'll find one patient with diabetes.
You are right.
Yeah, right.
Yes, particularly in Gujarat, we have lots of patients with the diabetes type 2.
Yeah. The food habits have become so deteriorated.
Yeah,
even the lifestyle.
Yeah, of course. Yeah.
So
that is the reason.
Does stem cells help with diabetes and hypertension as well?
Not hypertension, but in diabetes, yes, definitely we can help with this treatment. And Vishakha, not only diabetes, because of diabetes, high sugar, there are so many things going on at the same time. Like it damages the liver part, kidney, their muscle weakness, their vision. So with diabetes, with high sugar, there are so many things we can prevent with the stem cells.
The patient's life expectancy gets bigger and better.
We can give them a quality of life.
Yeah,
that is the main thing. Yeah,
makes sense.
Yeah.
So it's basically a whole package. The body gets transformed and also gets rejuvenated from inside.
True.
Right.
That's true. Yeah.
Let's talk about the very common problems where medical science is not, I think, helping a lot. The Parkinson's, Alzheimer's, the neurological conditions and disorders. How is stem cells going to transform these disorders for people?
In neurological condition, there are so many neurological conditions basically, and there is a thin line between them.
Okay.
So in such neurological conditions, we have treated patients and we have good results in that. Particularly if I talk about Parkinson's patients, not only because these are the progressive conditions. In that case, if we slow down the progression or stop the progression, that is also positive. Forget about improvement. So in Parkinson's, we have seen improvement also. Not in one patient. There are so many
So many
patients we have
patients.
seen that improvement also.
Nice.
And there is no medication for Parkinson's, but with stem cells, yes, we have seen that results.
Oh, with that I remember there was a case that you had told me sometime, I guess a week or two ago. There was a patient with, I think, skin cirrhosis, and that is,
That is a different condition, but yes, now he's doing good. Skin psoriasis,
yeah.
and yes, he was taking medication, steroids, and all this for long time. And after that, he came to know about this treatment. So I gave stem
Yeah.
cell therapy to him,
And I
and
think it has
now
become
he's out
improved.
of that condition.
See.
He's doing very good. He's out of psoriasis, and he's fine, absolutely
And
fine. He's happy.
I've heard Dr. Patel that psoriasis has no medical treatment for now. I mean, it does get better, but it doesn't go away.
True, but with stem cells, it will go away for sure.
Oh my God, that's transformative to know, right?
Yeah.
Let's continue further and know about what does the consultation process here in CellStar looks like.
Oh, it's very easy, Visakha. Patient can go through our website. There are so many, nowadays we are using social media.
Social media is there, yeah.
Yeah, and our facility itself on a very well famous road in Ahmedabad.
Science
which
City,
is
of
on
course.
So
It's
it is
very much
easy to-
available,
yeah, of course. Yeah, it is
So
very easy.
people with need or with similar conditions can always come to CellStar. And as we have already discussed, it's on CellStar is in Science City Road, and it's the Capital 2 is the building. And you can always connect with us on the mail provided on the e-website of the page Google provides. And we also have a Google page where we have provided number, so you can always connect to us at any time available.
Yeah.
Let's talk about further. Do we have a lab inside the hospital?
Of course, we have a lab inside the facility, yes. And
Okay.
which is very highly equipped. Everything we brought from USA, very standard protocols
Okay,
we follow, yes. So we have a lab here.
So providing a lab also makes it very easy for me to understand that we have highly equipped OT and patient
Obviously.
rooms,
Yeah.
right?
So we have 3 rooms. One is recovery room and 2 patients room.
Okay.
We have operation theater, procedure room. We have, as I said, hyperbaric chamber.
Yeah.
In fact, we do some treatment here for cosmetic purpose,
Yeah.
and that is also we have that facility here. That's it.
I am so shocked to know the anti-aging process becomes so easy.
Yeah.
Because all these days we are only aware of the 3-4 names, that is Botox, fillers.
In fact, Vishakha, I tell you, the beauty of this treatment is that it's a daycare procedure. So patient, if they come in the morning hours, we'll discharge them by the evening time. That is the thing.
Oh,
So
that's
it's a
so
daycare.
nice.
Basically, we need
Hassle
few hours.
free.
We need
Hassle
few
free.
hours only. That's it.
So
Yeah.
if there's a patient coming from any other state also, or suppose country, it's very easy and convenient for them to just take the procedure in the morning and then just go away if they want to.
Yes.
So there is no pain, there is no endurance. So much more convenient than usual.
Absolutely.
Yeah.
And we have divided this therapy into 3 stages. Like patient comes for the first time, so we call them for the second and third cycle. It is like that. We have designed that kind of protocol. So patient has to come here for 3 times, maybe more than that or less than that. But this is our standard protocol. They have to come here for 3 times.
Okay,
Yeah.
that's
That is one
that's
treatment
how.
in 3 parts. Yes.
Okay, a treatment is divided into 3 segments.
Yes.
For more efficient results.
But it's a day, as I said, it's a daycare
procedure.
They
So
come
they
in
have
the
to
morning.
come and then they can leave by evening.
Yes.
Okay, that's very convenient to know as well.
Yeah, it is very
And
convenient.
I was actually talking about the anti-aging process.
Hmm.
I myself, I'll tell you an experience about myself. So I went to a cosmetic doctor 2 days back. So I have this textured skin problem.
Right.
So I thought of asking, what can I change into my day and night time routine? So she, before giving me any consultation, straight away told, you should go for PRP or you should go for micro needling. And needling is definitely going to harm my skin in future.
Yeah.
The chemical peeling and all, these days are very in the hype. I am so shocked to know now that these chemicals are only processed and used on your skin, even if it's a dermat. So I would want to try the stem cells therapy skin rejuvenation process where I'm naturally going to be under this process and going to be actually reversing my age
Yeah.
10 times of what I am right now.
You are absolutely right.
Yeah, this is so nice and new. Even I want to take the hyperbaric oxygen therapy. That sounds so fascinating.
Anytime you can come and you have that facility.
Yeah. And the question that I have been revolving around my mind, I'm sure viewers also want to know, that stem cells are, I think the word stem cells is quite overdated or maybe outdated. There's so much more that people don't know that has come.
Of course, as I said, we do exosomes, we do peptides,
Yeah,
even
yeah.
organ-specific peptides.
Yeah.
We do collagen for the anti-aging treatment, cord blood. There's so many things. There's no limit. Sky is the limit actually.
Yeah,
In this
right.
regenerative medicine, sky is the limit. And we do almost everything here. We have all kind of facilities. And yes, one more thing. We treat cancer patients as well.
Yeah, so you
Yes.
took away my words. I was going to ask you about
Yeah,
cancer
yeah.
therapies also,
So there's no side effect, without any side effect.